February is National Children's Dental Health Month, and dentists are trying to make sure they don't see any cavities or something worse when the kids come in for a checkup. Dr. Don Gundlach is joining us now with some advice for parents. Doc, good to see you.
Good to see you.
Let's talk about this first, because as a parent of young children, I'm curious to know your take. Are cavities in baby teeth that big a deal? I mean, obviously we lose the baby teeth, so really what's the hassle?
So each tooth, you got to remember, each tooth is a vital organ. It has its own innervation, its own blood supply, and it serves a specific function. And those teeth are designed to be in there for 8 to 10 years. And without teeth, their primary function is to chew. And if you can't chew, you have difficulties with a number of things.
Sounds pretty basic. Well, and there's an educational component as well.
Right.
If you don't learn to take care of those baby teeth, you're not going to take care of the adult teeth either.
Exactly. And the adult teeth come in at 6 years old, so they come in at a fairly young age. So we want to make sure that all those habits are in place before those adult teeth come in.
Absolutely. Let's talk a little bit about the impact of dental hygiene on a young person. How important is it?
Well, it's very important because the teeth themselves, the baby teeth are very prone to decay, and they will affect the nerve very quickly. And so you go to these, you get a small cavity that progresses into an abscess, and it really limits their ability to chew, causes them pain, it affects their grades in school, affects their ability to sleep. It's a lot of things going on with that.
Common sense will tell you, particularly when you're a new parent, you know, if you got a mouthful of candy all the time, that's not good for teeth. But there are some kind of hidden things that I learned as a young parent that are bad for teeth that maybe you hadn't thought of. What's on your radar there?
So there's a lot of things, especially drinks are a big problem for us, and snacky foods, because you know it's a whole different lifestyle we have now, where the kids are picked up from school. Here's some food to eat. Let's go to your sporting event. You know, you're giving them, you know, the goldfish crackers, you know, raisins, things that are going to stay in contact with the teeth for a long period of time, especially after school, because their mouths are dry, really contributes to the amount of decay that we see.
All right, well, we're not going to drastically change our lifestyle. So then what do you recommend to parents who are like, look, we're on the go a lot, we're going to be doing a lot of that? What's your recommendation?
So what I would recommend is be somewhat prepared. You can try things like sliced apples. Make sure your children are hydrated, so always supply them with water. Water and milk are the two best things. Milk's a little tricky in the car, keeping it cold, but water is the best thing you can have. Avoid juice, avoid soda, and avoid energy drinks.
As long as I got you, let me ask you about something that I know a lot of parents are concerned of. What if you have a thumb sucker in the family? I know I was told, like, it's going to mess up your mouth forever, it's real bad. Is it?
It can. It depends on how long it progresses. You know, the sucking is a very calming effect for children. So
absolutely.
So it calms them down, and it's a reassuring thing for them. So it's a gradual change. Talk to your pediatric dentist after the age of about 3 or 4. Then we have to start making some movements until then. And then until that point, the bones and everything kind of go back to where they're supposed to if you get them to quickly.
All right, so if they're real young, don't stress about it, but it gets to a point, right?
Right.
I suppose probably for socialization too, it's a good thing either way.
Good thing to have, yes.
All right, Doctor, thanks so much, and have a great month here as we continue to educate people on these issues. And you can find more information on our website. It's up there right now at tmjford.com. Just head to the links section.